Chronic pain is a global health crisis affecting nearly 20% of people worldwide. Unlike acute pain, which serves as a protective alarm, chronic pain persists beyond normal healing and becomes a complex, disabling condition. Many patients struggle for years, with less than 30% finding meaningful relief from current treatments. This video explores the latest scientific understanding of how immune and inflammatory mechanisms drive the transition from acute to chronic pain and why this matters for future therapies. Let's begin by understanding what makes chronic pain so different and why it remains such a challenge for patients and clinicians alike. Decades, pain was thought to be a simple result of nerve injury or tissue damage. However, research now shows that pain is shaped by a dynamic interplay between the nervous system and the immune system. When tissue is injured, immune cells rush to the site, releasing molecules called cytokines that can sensitize nerves and amplify pain signals. This immune response is not just a bystander, it's a key player in whether pain resolves or becomes chronic. Understanding this neuroimmune dialogue is crucial for developing better pain treatments. Injury occurs, a coordinated immune response unfolds. Pro-inflammatory cytokines such as interleukin-1 beta, IL-6, and TNF-alpha are released, sensitizing pain-sensing neurons called nociceptors. Macrophages, T lymphocytes, and mast cells infiltrate the area, creating a pro-nociceptive environment that can perpetuate pain. These immune cells don't just fight infection, they actively shape the pain experience, sometimes tipping the balance toward chronicity. The local environment, rather than systemic inflammation, often determines whether pain persists. Beyond the site of injury, pain can become amplified in the central nervous system. Microglia and astrocytes, immune-like cells in the brain and spinal cord, become activated, releasing more cytokines and remodeling synapses. This process, called central sensitization, leads to persistent neuroinflammation and makes the nervous system more sensitive to pain. The loss of inhibitory control and increased excitatory signaling are hallmarks of this state, making pain feel more intense and harder to treat. T helper cells play a pivotal role in determining pain outcomes. Pro-inflammatory Th1 and Th17 cells promote pain by releasing cytokines that sustain inflammation. In contrast, anti-inflammatory Th2 and regulatory T cells, TREGs, help resolve inflammation and support healing. The balance between these cell types can tip the scales toward either pain resolution or chronification. Individual differences in immune responses, including genetics and environment, help explain why some people develop chronic pain while others recover. It might seem logical to suppress inflammation as quickly as possible after injury. However, recent studies reveal a paradox. Premature use of anti-inflammatory drugs like NSAIDs or corticosteroids can disrupt the body's natural resolution pathways. Instead of helping, these medications may actually increase the risk of pain becoming chronic by interfering with specialized pro-resolving mediators and regulatory immune cells. This finding challenges traditional approaches and highlights the importance of timing and context in pain management. Pain is not just a biological phenomenon, it's shaped by psychological and social factors. High levels of stress, anxiety, or poor coping strategies can prime the immune system, making the nervous system more reactive to pain. In children and adolescents, parental catastrophizing and lack of social support are linked to worse pain outcomes. These psychosocial factors interact with immune pathways, influencing the risk of pain chronification and highlighting the need for holistic approaches to pain care. Microglia, the brain's resident immune cells, are central to pain amplification. When activated, they release cytokines and neurotrophic factors like brain-derived neurotrophic factor (BDNF), which further sensitize neurons. BDNF, produced by both neurons and immune cells, triggers intracellular pathways that promote pain. This cellular crosstalk sustains the pro-inflammatory environment, making pain harder to resolve. Targeting these interactions is a promising avenue for new pain therapies. Nerve growth factor (NGF) is another key molecule in pain chronification. Originally known for its role in nerve development, NGF also sensitizes pain fibers and activates mast cells in adults. Blocking NGF with monoclonal antibodies has shown promise in experimental models, especially for conditions like osteoarthritis. This highlights how targeting specific immune mediators can offer new hope for patients with chronic pain. Not all inflammation is equal when it comes to pain. Research shows that local inflammation at the site of injury is more relevant for chronic pain than systemic inflammation. For example, blocking TNF-alpha locally in the spine can reduce pain, while systemic suppression often fails. This insight is shifting the focus toward targeted, localized interventions rather than broad immunosuppression. Recent discoveries have highlighted the role of B cells and autoantibodies in chronic pain. In some conditions, autoantibodies target nerve proteins, leading to pain by activating immune receptors or disrupting ion channels. This autoimmune component is especially relevant in disorders like fibromyalgia and complex regional pain syndrome. Identifying these mechanisms opens the door to new diagnostic biomarkers and targeted immunotherapy. Immune system's response to injury is a delicate balance between pro-inflammatory and anti-inflammatory forces. Pro-inflammatory T cells and cytokines drive pain, while regulatory T cells and cytokines like IL-10 and TGF-beta promote resolution and healing. The presence or absence of these regulatory signals often determines whether pain resolves or becomes chronic. This duality is a key target for future therapy. Men and women experience pain differently, and their immune systems respond in distinct ways. In men, microglia and SIRT signaling pathways are more active, while in women, T-cell-mediated mechanisms and hormonal influences play a larger role. These differences affect how pain develops and responds to treatment, emphasizing the need for sex-specific approaches in pain management. Understanding immune mechanisms in pain opens new therapeutic possibilities. Strategies that support the body's natural resolution pathways, such as promoting regulatory T cells, using specialized pro-resolving mediators, or targeting local inflammation, are gaining attention. However, translating these findings from animal models to human patients remains a challenge, and more research is needed to develop safe and effective treatment. Surprising new player in pain chronification is the gut microbiota. The composition of gut bacteria influences immune responses and pain susceptibility. Short-chain fatty acids produced by beneficial microbes can promote anti-inflammatory immune cells and reduce pain. Interventions like probiotics, dietary fiber, and even fecal microbiota transplantation are being explored as ways to modulate pain through the gut-brain immune axis. Body produces its own pain-relieving molecules, known as endogenous opioids. These are released by immune cells like T lymphocytes and macrophages, especially in anti-inflammatory environments. While pharmaceutical opioids can suppress immune function and sometimes worsen pain, supporting the body's natural opioid pathways may offer safer, more effective relief. Techniques like electroacupuncture have been shown to stimulate these endogenous systems. One of the most important lessons from recent research is that timing matters. Some interventions are only effective during specific phases of inflammation. For example, blocking inflammation too early can prevent the activation of resolution pathways, while waiting too long may allow chronic pain to become established. Personalized, time-sensitive approaches are needed to optimize pain treatment and prevent chronification. Future of pain management lies in precision medicine. By identifying immune signatures, such as cytokine profiles, immune cell phenotypes, and genetic markers, clinicians can predict who is at risk for chronic pain and tailor treatments accordingly. Biomarker-guided therapies and real-time immune profiling are on the horizon, promising more effective and individualized care for pain patients. Despite exciting advances, translating findings from animal models to human patients remains a major challenge. Differences in immune networks, pain mechanisms, and environmental factors can limit the effectiveness of new therapies. Most preclinical studies focus on acute pain or lack psychosocial context, making it difficult to predict real-world outcomes. Ongoing research and improved clinical trials are essential to bridge this gap. Current knowledge is limited by the lack of large-scale, longitudinal human studies and standardized immune profiling. Many findings are based on animal research or cross-sectional data. There is also risk of publication bias and difficulty accounting for the complex interplay of genetic, psychological, and social factors. Future research must integrate multidimensional data and focus on prospective patient-centered studies to truly advance our understanding of chronic pain. Chronic pain is not simply a matter of ongoing injury, it's a complex interplay of immune, nervous, and endocrine systems. The regulation of inflammation, especially through immune cells and cytokines, is central to whether pain resolves or persists. Modifiable factors like medication use, diet, and gut microbiota also play important roles. As research advances, the goal is to develop targeted, personalized treatments that restore balance and promote healing, offering new hope for millions living with chronic pain.